do a little switch up here and bring Nicole Mattfeld as a speaker next. She is a hospice therapeutic music and hospice care provider. Nicole's passionate work with hospice patients is commendable, and the bond she shares with her clients and families are as precious as herself. So please welcome Nicole Mattfeld.
Well, thank you so much. It's such an honor to be here and to be amongst all these wonderful speakers. I'm really excited to talk about this. So as she said, I am currently a therapeutic hospice musician. And prior to that, I taught high school choir for 8 years. And so this idea of hospice and healthcare is actually quite new to me. I've only been in it for about a year. And it's not only been therapeutic for my patients, but also for myself, because being, 31 years old, I've never really thought about a healthcare directive or what it would look like, to pass away or hospice. Fortunately, I haven't had a lot of my family members be sick. And so for me to have sort of this new viewpoint on what hospice means and what death means, it's really changed the way that I think about death. I think that oftentimes talking about like a healthcare directive or end of life can be sort of a taboo thing and a scary thing. And having worked in hospice for the past year, it's really made me realize that it truly can be, as you say, a gift, a beautiful thing. And as long as you have, the patient's wants and desires set in place, it can really be therapeutic for not only the patient, but the family as a whole when someone does pass away. And so, of course, our goal today is to, share the importance of a healthcare directive. And just from a hospice point of view, I've been in situations where people have had healthcare directives in place. Usually everyone who comes onto hospice has one. And so that's really nice because we really are able to honor the patient's wishes. Many of them, what I do when I come into a patient's room, I use live therapeutic music based on their current state of being. So I went through a program called the Music for Healing and Transition program, and it actually focuses on end of life music. And so there is different music for pain management or for memory loss and cognitively impaired. And then there's also specific music for transition period through death. And so I've actually been in the room when patients have passed away as I've been singing and playing. And it truly, even though it's difficult and it's hard and it can be sad because there's obvious grief that this person is leaving this world. However, the family knows that this is what the patient wanted. And so there is a sense of relief and almost a happiness saying, this is where this is how this patient wanted to go. They were able to choose everything for themselves because of things like a healthcare directive and because hospice is able to use that to sort of create the best environment that person would want at the end of life. And so again, it changed my perspective of death because I always thought that it was something scary and I didn't want to talk about it, but now I talk about it in a much more beautiful way. And it really can be a wonderful thing for the family to have this healthcare directive. Again, they don't have to worry about making these decisions for the patient. They know exactly what the patient wants, how they want to go, the comfort cares that they want. And not only do we offer music from Knut Nelson Hospice, but there are things like Reiki, massage therapy, there's aromatherapy. And so these are all things that, you can think about as you're doing a healthcare directive. Like Emma said, this death playlist, how wonderful for that person to have that playing. And so I think you can go beyond just, the DNR or CPR thing and really think about the whole person. And we really try in hospice to focus on the person as a whole, both body, mind, and spirit. So again, just be thinking about those things beyond just the physical part of it. And I do want to share just one story that COVID really brought to the forefront. Unfortunately, I was I worked with many COVID patients who suddenly had bad health care because of COVID. They took a real quick turn. And I remember one gentleman specifically who just overnight basically went imminent. And his family lived out in California, and he did not have a healthcare directive. And I remember that I sat with this gentleman and sort of talked to them about what he wanted while the family was on the phone. And I was able to hear the difficulty in the son hearing his dad say, you know, I don't want to go to the hospital. I want to go be with my wife in heaven. And it was difficult for the son at that moment, because not only was he dealing with losing his father suddenly, but then he has to deal with his, you know, not being able to make this decision. And I was just reflecting on that. And I thought how much better that moment and that transition would have been if they would have had that conversation prior to that moment. And it ended up being a really beautiful thing. I was there as he passed, and his son was able to fly there. And it was one of the ones that I was singing for as he passed. And it ended up being really beautiful. But amidst all that, there was a little bit of stress from the son. And I just think, you know, you make a healthcare directive not only for yourself, but for your loved ones, so that they're not put in that situation. And fortunately, or hopefully, none of us, you know, have to face that sudden health change, but we really don't know when our health will change on a dime. And I think having a healthcare directive at any age can really benefit everybody involved in your lives and yourself. And another thing I want to add is, for a healthcare directive, I know for my own and my husband's, we both have the music that we want in our funeral and our healthcare directive, because music is such a huge part of our lives. And I've been involved in planning the funerals for some of my hospice patients. And I know that that can really be therapeutic for the family as well, to hear those songs, you know, during this person's celebration of life. Once they have passed. So just those things to think about beyond just the physical, you know, part of things like the DNR. I think about maybe the things that you would want to help your soul and your spirit as well while you are passing on. So I just want to thank you so much for asking me to be here, and I hope you all have a wonderful day.